Now I am pleased to introduce Amber Mack, Research and Policy Analyst at Healthy Mothers, Healthy Babies Coalition of Georgia. This position is a front providing services and promoting policies to ensure all babies in our state receive the health and care they deserve. Welcome, Amber.
Thank you so much for having me. So happy to be here with you all today. And I will be speaking about the current maternal mortality crisis that the state of Georgia is facing. So let's go ahead and get into the facts. So I know that there has been a lot of conversation about whether Georgia as a state is the worst in maternal mortality, bottom 10. There's been a lot of debate about that. Regardless, we are facing a crisis. From 2012 to 2015, we saw 342 deaths of women that were either pregnant, delivering, or in the postpartum period out to a year. 42% of those deaths were related to pregnancy, whether that was direct or indirect. The rest were they happened to be pregnant and may have died of other causes like a car accident or homicide. I know a lot of times when we think of maternal mortality, we're thinking of women that die while they're pregnant or they die in the midst of giving birth. However, in Georgia, 80% of our deaths that are related to pregnancy occur in the postpartum period. Even more shocking is the fact that of all of our pregnancy related deaths, 2 out of 3 deaths are preventable, which means most of those deaths should not have happened. And worst off, we see that among those deaths, and this is from 2012 to 2014, 60% of those pregnancy related deaths were among Black women who experienced death at about a 3 times higher rate than white women. So now that we have this sobering picture, let's look into what we can do about this issue. So, there have been efforts among advocates, legislators, and a host of organizations to address this crisis. Main one being extending the coverage of postpartum Medicaid to 12 months. Currently, it's at 60 days. We are a non-expansion state. So after 60 days of coverage, a lot of women are losing the care that they would need to prevent maternal death and improve their health. We do have a bill that is in progress, House Bill 1114, that's sponsored by Chairwoman Sharon Cooper, and happy to report that that passed out of the Senate Health and Human Services Committee yesterday. And so just keeping up with next steps with that. We also have the Maternal Mortality Study Committee that convened last fall that comprised of legislators and some obstetricians throughout the state where they really got to talk about the facts. What's the problem? What are some of the solutions? And they came out with some recommendations based on that. And over the past 2 years, happy to report that the General Assembly has been great in terms of funding these initiatives. However, with the COVID-19 pandemic, a lot of these maternal mortality reduction initiatives were hit disproportionately and can have some long-term effects on our crisis. That includes the maternal mortality prevention hospital programs, which work to implement initiatives including neonatal abstinence syndrome, hemorrhage, and cardiomyopathy and hypertension, which are some of the leading causes of maternal death. That currently is facing a 75% cut. We also have the maternal mental health program, which would help providers screen, treat, and refer women to appropriate services when they're experiencing mental health crises, postpartum, or while they're pregnant. That originally was facing a 100% cut, but I'm happy to report as of yesterday, those funds have been retained. So as of now, it is fully funded, of course, still continuing to fight and watch out for that. We also, as was mentioned, have some disparities in terms of what places get care. So we have about half of our counties that do not have obstetricians, and that specifically affects rural communities. So there were 3 rural perinatal satellites that were proposed to be done throughout the state, and currently that is facing a 100% cut. And lastly, Morehouse School of Medicine has proposed a center of excellence to study our maternal mortality crisis and what some of the contributing factors are to that, as well as engaging the community. But because of proposed cuts to their general operating grant in response to the crisis, or the pandemic, I should say, that center is up for a potential cut as well. So, we know what the problem is. We know what we can do to address it. The legislature has been responsive in addressing those issues and funding those initiatives, but right now it's really a matter of retaining the funds.